The number one reason you get drop-off going from a fertilized egg to a day 5 embryo and beyond is because a lot of eggs are just inherently very abnormal. And this just happens with time because we can't make new eggs or repair our eggs. And so as we age, we get a sharper drop-off. We typically tell everyone to expect some attrition going from a fertilized egg to a day 5 to day 7 embryo or a blastocyst embryo. And usually we say an average rate of about 60% of fertilized eggs will make it to the embryo stage. Could be around 50 to 60%. So what happens if you have less than that get to the blastocyst stage? Like you get 8 eggs and 7 fertilized, but only 1 makes it to the embryo stage. Well, you have to ask yourself why this could be happening. Like I said, the number one reason is that it could be egg quality related, and typically this is something we see with advancing age. But what if you're, let's say, under the age of 35 and you have this sharp drop-off? What can you do about it? Keep in mind, this is not an exhaustive list, and this is based on my personal experience as a fertility doctor. When I see a young patient and I'm like, wow, that was a sharper than expected drop-off and it was really disappointing, I think about 3 main things. One is, could this patient have PCOS? Not every patient with PCOS is going to have egg and embryo quality issues, but there are a subset of patients that have insulin resistance that can alter the microenvironment of the ovaries in a way where there's more androgens being produced, like testosterone, and using drugs like metformin in those scenarios can be helpful in restoring a more normal, optimal environment. And the environment where the eggs are maturing is important because as eggs are getting pushed through the different stages of maturity, they're going through a genetic reorganization, and that's when these errors tend to happen that can result in an embryo coming from that egg having missing or extra DNA. And a lot of those embryos will stop growing before they can even have the opportunity to be tested and frozen. So I'm not saying metformin is for everyone, but it's definitely something worth exploring if you're in this situation and you've been told that you may have PCOS. The number 2 thing that I would explore is more of an investigation than a treatment, but it's doing something called a karyotype. So I would do a karyotype test on the individual who's having the sharper than expected drop-off and their partner. So you're looking at the structure of their chromosomes, it's a blood test, and we're basically trying to identify if there is a rearrangement in their DNA that could lead to a higher than expected proportion of embryos when both of their chromosomes line up, being genetically imbalanced or abnormal. If we find a genetic rearrangement in the karyotype for either partner, the treatment may be the same, but at least now you know why and you know what to expect, and it could actually change the way you would do the PGT testing. The third thing to think about when talking about high attrition going from a fertilized egg to the blastocyst stage, day 5 to day 7 embryo, is the sperm. We cannot forget about the sperm. Sperm just isn't contributing to the fertilization step. Sperm is also very important in helping to get embryos past the day 3 stage to the blastocyst stage. And there have been studies that have shown sperm quality can correlate with the ability to make blastocyst stage embryos. When we think about sperm quality, I'm not just talking about the semen analysis, which is a standard test that is very important and looks at things like concentration and the motility of the sample. But there's also specialized testing to look at the amount of DNA in the sperm that's fragmented. And this, if it's elevated, could be a potential contributing factor. And there are ways to sort the sperm differently, even before the step where we inject the sperm into each egg, called ICSI. And this is called microfluidic sperm sorting, also known as technologies like Zymot. And you can try to utilize this type of technique to isolate a healthier fraction of sperm with less DNA fragmentation and use that sperm to fertilize the eggs. And this could make a difference. That's beneficial. It might not. We have data that shows that there are lower rates of DNA fragmentation in sperm sorted this way, but it hasn't really been shown to make a clinical difference. But it certainly isn't harmful and could be helpful and is worth exploring. So these are just 3 quick things that I will often think about when I see more attrition than what I was expecting for age. Again, the number 1 cause of attrition is age and egg quality issues, but it is important to make sure that you're leaving no stone unturned and you're considering all of the possibilities.